Good afternoon, everyone, and welcome to the final plenary session of this year's Healthy Eating Research virtual annual meeting. We're thrilled that you've joined us today for our final plenary session, Continuing to Build Back Better Annual Policy Updates and Insights from USDA. In just a minute, I'll introduce today's moderator, but before I do that, I want to highlight some logistical reminders for today's session. All participants are joining in listen-only mode. So if you have any logistical or tech issues for which you need support, please don't hesitate to put those in the chat box during today's session. And if you have any Q&A for our speakers at any point, you can submit those through the Q&A function in the bottom right of your Zoom screen. So as I mentioned, today's session is really focused on policy updates. It's a popular session every year, and we're thrilled this year to have some new additions from USDA as well. But in order to get the session officially kicked off, I'd like to introduce Tracy Fox. Many of you know Tracy. She has over 30 years of experience working at the federal, state, and local community levels and the private sector on food and nutrition policy, strategic planning, legislative and regulatory processes, consensus building, collaboration, and advocacy. Tracy has been a longtime advisor on our National Advisory Committee for Healthy Eating Research, I think since nearly the very beginning, and has been a real addition, a real value addition to our team. Since moving to Culver, Indiana in 2014, Tracy has developed an expertise in rural health and wellness issues and challenges facing rural communities. In 2020, Tracy joined USDA's Food and Nutrition Service as a nutritionist, where she is responsible for program development, analysis and evaluation, and technical guidance for nutrition-related issues in USDA foods. Tracy, with that, I will go ahead and turn it over to you to introduce the session today.
Thank you, Megan, and hello, everyone. I'm excited to be moderating this session. This is one of my most favorite meetings of the year and one of my most favorite sessions as well. So as Megan said, I currently work at the Food and Nutrition Service at USDA. However, I'm here today in my personal capacity. The views expressed are my own and don't necessarily represent those of USDA or the US government. So now the lawyers are happy and we can move on with the session. As I was actually reading over my introduction notes from last year's session, I was struck by how much the administration had already done just in those few months leading up to that meeting. But when I reflect on what has transpired over the past year, it's clear the administration has continued to move forward in important nutrition and agriculture areas, including reevaluation of the Thrifty Food Plan, increased infrastructure and food funds for charitable food organizations, a stronger commitment to addressing climate change through sustainable agriculture, transitional nutrition standards to strengthen school meals, new equity commission, implementation of tribal food sovereignty demonstration project, and a recent fiscal year 23 budget proposal to help USDA fulfill the priorities they've laid out. And to that end, perhaps the priority that's garnered the most attention is the one on nutrition security. And we could not have a stronger advocate and expert to talk about it than our policy keynote speaker, Dr. Sarah Bleich. Dr. Bleich is the Director of Nutrition Security and Health Equity, a new position in the Food and Nutrition Service at USDA. Prior to that, she served as a USDA Senior Advisor for COVID-19, and she is on leave from her post as a professor of public health policy of the Harvard School of Public Health and the Kennedy School of Government and the Radcliffe Institute for Advanced Study. So speaking as myself, again, and not as a USDA rep, I have certainly enjoyed and appreciated the accelerated focus on nutrition security at USDA. And I will say, Dr. Bleich, you've made it a bit easier for those of us who are nutritionists to do our jobs and to be recognized for the work that we do. As many of you know, Dr. Bleich has been a part of the healthy eating research community for years and has been a valued and trusted voice to many. We're fortunate to have her join us today and look forward to hearing about the exciting work she and others are involved in at USDA. With that, I'll turn it over to you, Sarah.
Thank you so much for that very kind introduction. And hi, everybody. You know, my last professional flight until very recently was HER in, where were we, Denver? I can't remember exactly where we were, but that trip where we all came back and then COVID happened, that was my last professional trip. And so I feel like life is kind of bookended right now, but it's great to see so many familiar names in the chat. Like Tracy, this is definitely my favorite academic conference, and it's really nice to have an opportunity to attend this year. As Tracy said, I'm really excited to be serving in this new role in the Food Nutrition Service at USDA, focused on nutrition security and health equity, and had a wild ride last year doing all things COVID in the office of the secretary. And it was fun and interesting and hard and challenging, but I really enjoyed it. And I hope you'll bear with me, because before we jump in, I do want to give a few shout outs. I want to first acknowledge HER for all of their innovative work over the past decade to build the evidence base to support healthy eating. I had the privilege of being a former HER grantee, and I know firsthand how critical this support is to conduct time-sensitive, innovative policy research. I also want to thank those of you who I have reached out to over the past few months for advice and insights. It has really been very helpful. I feel personally like I have the weight of the public health nutrition community behind me. I feel like I can pick up the phone and call you if I need help or advice. And I just want to personally say thank you. Like, the one thing I do want to also be sure to underline is that after that HER meeting that happened it was Colorado. Yes, it was Colorado. After that HER meeting, one of the things that quickly got stood up is that HER collaborated with NOPRIN to develop the COVID-19 Food Nutrition Working Group. And that, as you all know, was co-founded by Dr. Sheila Fleischhacker. Now, Sheila knows everybody, but if you don't know her, she's now working at USDA, and I have the privilege of working with her day to day on all the nutrition security work. Now, that COVID-19 Food Nutrition Working Group was really productive. It produced more than 40 publications, presentations, policy briefs, media articles, and many of you all in this virtual room contributed to it. And that was all while trying to adjust to pandemic life. And as Sheila always says, teamwork makes the dream work. And that was so evident by the volume of scholarship that was produced by that working group. I do also want to recognize how important it was that HER quickly secured critical research funding to examine COVID-19 related relief and recovery policies that impact child health and well-being. This included SNAP and WIC and school meal adaptations and PEBT. And these critical investments are helping to build the evidence base. And they did that during the early stages of the pandemic, which is ultimately helping to shape policy decisions. And it's helping us to digest lessons learned from this pandemic. And it was great to hear about a lot of those results on Tuesday. I'm also thrilled to see HER's recent call for proposals aiming to examine how broader social and economic programs and policies related to poverty reduction, like financial payments to families or income assistance programs, how those impact childhood obesity, diet quality, food security, and other important child and family health outcomes among lower income families and communities of color. And last but not least, I do want to single out Dr. Mary Story. I am personally so thankful to her for her mentorship throughout my career. She has truly made, and I'm sure you can all agree, she has made HER feel like a home for so many of us and has cultivated a really talented pool of public health researchers. So Mary, thank you. So let me jump in, and what I want to cover with you today are 3 topics. First, I want to give you an overview of the intersection between nutrition security and health equity, and that will include some key definitions. I'm hoping that several of you or most of you saw the Secretary Vilsack's speech on nutrition security a few weeks ago in New York, and then that was followed by a moderated discussion with an HER grantee, Dr. Pam Cook. The second thing I want to do is give you an overview of USDA's actions to promote and elevate nutrition security. And then I'll end with highlighting ways you can help us build the relevant evidence base and translate your research into action. Now, we're not going to have a huge amount of time for Q&A, but after the remarks are over, I would love to hear your thoughts on how HER and each of you can help us promote and elevate nutrition security. So we'll use the Q&A time today. I'll also be presenting to NOPRIN in June and some of the HER NOPRIN working groups this spring. And you can always feel free to reach out to me or share thoughts via email, or we can schedule a time to meet. So let's jump into the meat of this. So as you know, the term nutrition security has been used a lot over the past year, and that's largely since Daria Mozaffarian published it actually discussed it first on a NOPRIN presentation and then published it as a JAMA commentary. And Sheila was one of the co-authors of that commentary. And what's become increasingly clear is that if you ask 10 people what nutrition security means, you may get 10 different answers. So one of the things that we did in March, which is National Nutrition Month, is we launched a big comms effort to try to get everyone speaking the same language when it comes to nutrition security, recognizing that there may be some future refinements. So what is it? Well, what the concept of nutrition security is doing is it aims to better recognize the coexistence of food insecurity and diet-related diseases and disparities. Specifically, nutrition security means consistent access, availability, and affordability of foods and beverages that promote well-being and prevent diseases, and in some cases treat diseases. And this is particularly true among racial ethnic minority populations, lower income populations, and rural and remote populations, including tribal communities. What nutrition security is doing is it's building on and complementing efforts to address food security, but it's distinct in two different ways. One is that it recognizes that we are not all maintaining an active, healthy life consistent with federal recommendations. And two, it is deliberately emphasizing an equity lens. So to say it most simply, you can think of nutrition security as having consistent and equitable access to healthy, safe, and affordable food. So what about health equity, a term that this audience knows really well? Briefly, what do we mean by that? So that's referring to everyone having an equal opportunity to live the healthiest life possible, no matter who they are, where they live, or how much money they make. What about structural racism? We cannot talk about equity without also considering the context in which we live. And while this slide offers one definition of structural racism, let me say a point that you all know well, which is there is no official definition of structural racism, and there are a lot floating around in the literature. But what all definitions make clear is that racism is not simply the result of individuals holding private prejudices, but it is produced and reproduced by laws and rules and practices that are sanctioned and even implemented by government, embedded in the economy, as well as societal norms. So confronting racism requires not only changing individual attitudes, but also transforming policies that underlie the US racial hierarchy. But let me be a little bit more concrete and talk about structural racism through some examples. So as a legacy of slavery, structural racism affects both population and individual health in three key interrelated domains. That's redlining and racialized residential segregation, mass incarceration and police violence, and unequal medical care. So let's take the second and talk about redlining and residential segregation. First off, what is it? What it refers to is discriminatory government-sanctioned practices that put services like financial services out of reach for Black people. So it made mortgages less accessible, which made prospective Black homebuyers vulnerable to predatory terms. Now, redlining officially ended decades ago with the Fair Housing Act of 1968, but its impact is still seen today in most American cities because it formed a platform for broad social disinvestment, especially in neighborhood infrastructure, so things like green space or services like schools and even employment. So I want to leave you with two top lines from this slide. The first, structural racism is real. It reaches back to the beginnings of US history and it stretches across our institutions and economy. The second is that structural racism harms health in ways that can be described, measured, and dismantled. And this is where nutrition security comes in. And this is where USDA and each of you at HER can make a difference. Now, many of you have worked in or around the federal nutrition safety net programs for a very long time. And you might reasonably be wondering, why is Secretary Vilsack, the Secretary of Agriculture, why is he so passionately focused on nutrition security now, as we can all probably agree that efforts to strengthen the public health impacts of the nutrition safety net have been increasing over the last decade? And here the answer largely lies with the pandemic and our administration's goal to advance racial equity. So what COVID-19 did, as you well know, is it brought health disparities and the vital need for access to healthy food to the forefront. So for example, one study estimated that nearly 2/3 of COVID-19 hospitalizations in the US were related to 4 diet-related conditions: obesity, diabetes, hypertension, and heart failure. And the disparities in diet-related diseases, as you know, are associated with decades of structural limitations to retail food outlets that sell healthier foods. They're also rooted in other longstanding historical inequities that we just spoke about. So what are USDA's actions on nutrition security? What are we trying to do? So As I've said multiple times, nutrition security is a core priority for Secretary Vilsack. And to meet this challenge, we are leveraging all of our assets to support moves towards healthier eating patterns in an equitable way. And so what I want to first talk about is what are the key equities that we're bringing to bear that make us uniquely qualified to lead the federal government on nutrition security. And there are 4 key ones that I want to put on your radar. The first is going to be the most obvious, and that's our nutrition assistance programs. Those reach tens of millions of Americans, including more than 30 million children each school day, nearly half of infants in the United States, and this is at about 99,000 schools and about 250,000 retailers. The second is our nutrition, education, and promotion efforts, which total more than $1 billion per year across all of our programs, with the largest being SNAP education and WIC nutrition counseling. In addition, Team Nutrition has recently awarded about $5.5 million in grants to help 21 states increase local foods in school meals. The third key equity is by translating the dietary guidelines for Americans through MyPlate and by a broader investment in research and food systems. And the fourth is all these other complementary activities across the department, like GusNIP, so the Fresh Fruit and Vegetable Incentive Program. So to guide us to our nutrition security, we have identified 4 pillars, and let me just run through those for you. The first is providing meaningful support from pregnancy to birth and beyond. The second is connecting all Americans with healthy, safe, affordable food sources. The third is developing, translating, and enacting nutrition science through partnership. And the fourth is prioritizing equity every step of the way. Now, let me say a little bit more about each of these pillars. And underneath of them, they each have subcomponents. So if we look at meaningful support, you can see that there are 4 subcomponents here. And I really want to emphasize 2 of them. The one is the one listed as ensuring benefits are adequate to support healthy eating patterns. You heard Tracy say this, and I want to foot stomp on it, but a key example here is our data-driven efforts, our reevaluation of the Thrifty Food Plan. So as a reminder, that's the basis for calculating the SNAP benefit. Based on the reevaluation, which happened in the fall, we increased the benefit by 21%. 21%. This resulted in the first permanent increase to the purchasing power of SNAP benefits since the Thrifty was introduced 45 years ago. What that does is it puts healthier food within reach. The second thing that I want to mention here is this effort to deliver high quality nutrition education. And one example is SNAP-Ed. So SNAP-Ed or SNAP education is available in all 50 states, the District of Columbia, the Virgin Islands, and Guam. And it's delivered through a network of 168 implementing agencies who are leveraging about 37,000 local partnerships, with the goal being to make the information hyperlocal and contextual. So the next pillar is healthy food, and that's got 3 subcomponents under it. And the one that I want to emphasize here is using incentive programs to promote access to healthy eating. So a program that all of you know well is GusNIP, or the Gus Schumacher Nutrition Incentive Program. And this is what it is intended to do, is it's intended to encourage the purchase of fruits and vegetables. And in the second year of this program, Amy Yarrow's team found that participants redeemed more than $20 million in nutrition incentives, and that participants also reported increased fruit and vegetable intake and improvements in food security. So big positive results in that second year evaluation. The third pillar is collaborative action, and there are 4 subcomponents here. What I want to stress is that first one, updating and building the evidence base for dietary guidance. So as you know, USDA and HHS regularly update the dietary guidelines for Americans, which is forming the basis for federal nutrition policy, education, outreach, and food assistance to reflect the latest nutrition science. Now, the 2025-2030 edition of the DGAs will be released by the end of 2025, and that process is well underway. And then finally, under equitable systems, there are 5 subcomponents. And here, what I want to focus on is expanding online shopping options for SNAP and WIC participants. One thing you saw over the course of the pandemic is that there was a rapid increase in the ability of participants to use their SNAP benefits for purchases online. And as of last month, that was up to 49 states and the District of Columbia. Now, on the WIC side, we are working to expand online ordering and transactions to bring shopping innovations to participants and to improve the overall shopping experience. So more to come on that. Do just want to also point out that there was data released last week by the USDA showing that nearly 1 in 5 people eligible for SNAP in fiscal year 2019 went unserved in an average month. Now, we'll say that most of these folks are individuals who would receive lower benefit amounts, but still, these are eligible individuals who are not participating in the program. And so we welcome ideas on how to build participation among SNAP and also WIC, where participation is at about 1 in 2 for eligible individuals. So to execute on the Secretary's goal to improve nutrition security, we're taking a two-phase approach to start out. So the first phase, we've been elevating the food nutrition service, nutrition security related activities, and we've been doing a lot of strengthening of external communications. And as I said, this began in March during National Nutrition Month. And some of the things that have come out as a result is we published a report about USDA's actions on nutrition security, which would encourage you all to read. And as I mentioned, the Secretary gave a speech, which was at Teachers College in New York. Now, the second phase is we're beginning to think strategically about future investments and hope that by clearly defining our lane, this is through that report that came out, we have stood up a series of web pages which detail our activities. We hope to make it clear where others can step in and create complementary value and where we can maximize new or existing partnerships. Do want to also make sure that you all are aware that there are a number of significant efforts that are underway that will advance nutrition security for tens of millions of Americans. So there's a list here, and I won't go through all of them, but want to flag that we are updating the WIC food package with science-informed changes. We are updating the school meal standards. We are also restructuring SNAP-Ed. Now, each of these efforts highlighted has so many different research gaps and opportunities. So I want to encourage you to review the Food Nutrition Service Research and Evaluation Plan for fiscal year 2022 that was released on Wednesday. And it was shared earlier this week during the weekly digest, and the link will be in the chat. I also want to make sure that you're aware of the joint USDA Economic Research Service and RWJF call for papers on food and health research. That leverages the USDA ERS Consumer Food Data System, and RWJF is funding up to 12 to 15 awards, each at $100,000. The link for that, I believe, is also in the chat. And then for fiscal year 2023, the president's budget was unveiled, and that was shared through the weekly digest, and it contains transformational investments that will bolster access to healthy, affordable nutrition for families and build on USDA's far-reaching nutrition programs. So the budget is going to have a number of steps that are going to help ensure and promote nutrition security. SNAP is going to be a key piece of that, as is WIC. The budget also has money for both programs, so it continues the provision of enhanced cash value benefits for WIC for women and children through 2023. And I'm particularly excited that there's also $23 million in the proposed budget for nutrition security to further and promote our efforts. So let me leave you with 3 concluding thoughts before I would really welcome your questions. The first is that now is the time to lean in, since food insecurity and diet-related diseases are high. We also know that diet-related diseases are rising due to the pandemic. It is also the case that both food insecurity and diet-related diseases are disproportionately impacting historically underserved populations. The second is that data science and public-private partnerships play an invaluable role in USDA's ability to not just provide all Americans access to safe, nutritious, affordable food, but also to help them understand how to prepare it on a limited budget and facilitate consumption across a range of life stages and food preferences. And as you all know, if you know me, I have 2 little girls, and believe it or not, they are now 8 and 10. My big one is almost my height, which is crazy. But the point that I want to leave you with is that I use the tips to help promote healthy eating among them. And so any way that we can think about how do we get these positive food messages among youth is really important. And last but not least, we cannot do this alone. So in addition to leveraging the equities at USDA, which we talked about, we're going to also have to effectively and efficiently engage and collaborate with external partners like HER in order to actually build the critical evidence base that's going to facilitate the translation of research into action for promoting and elevating nutrition security. So just want to thank you all for your attention. I know you all are doing tons of work in this space. I look forward to hearing about it, and let me stop here and take any questions. Thanks. Back to you, Tracy.
Thank you, Sarah. I really appreciate those comments. I was thrilled to see last week the announcement about the RWJF and Economic Research Service collaboration. It's so nice to see that kind of public-private partnership. I can't imagine how many hoops had to be gone through for that one, but congratulations on that. And thank you in general for the overview of USDA's actions on nutrition security. I've heard the presentation a few times, as I'm fortunate to be in USDA, but I always take something new away from it. So really appreciate you highlighting it and also weaving in sort of the implications for healthy eating research. That's really important. It is really great to see the Secretary's passion for nutrition. I appreciate his stories about broccoli, I think it is when I hear them, but and we also really appreciate the approach that the administration, certainly under your leadership, is taking in terms of the really inclusiveness of making sure that we're leveraging the other resources that are out there, being inclusive not only internally within the department, but also externally. So it really is going to take a village. And we know that the HER community has been and will continue to be a vital part of helping build the evidence base and translate the research into action. So you just touched on this quickly at the end, and so I can't let it go at that. But I want to congratulate you first for the securing the $23 million budget line item that's in the president's recent proposed fiscal year 23 budget on nutrition security. And again, I emphasize proposed because it is the president's budget. There's a little ways that it has to go, as we well know from this most recent appropriation. But can you please explain a little bit to HER community what's being proposed and what's the path forward for actually securing those funds?
Yeah, so we're super excited about this. Glad that you're asking about it. So the total is 23 million. And what I can really say at this point is that the intent of these dollars is to focus on building nutrition education and promotion activities to improve nutrition security and health outcomes for all Americans. So what form that takes is we're not really sure, and there'll be more details to come. But the 23 million is focused on nutrition security, largely in the form of nutrition education and promotion. But I do want to take a step back and just think big picture and say that the president, the secretary, the Food Nutrition Service, they care deeply about people not having enough food to eat. And they want to make sure that through policy, we are able to ensure that we address this hardship. But there's also a very big concern about not just people not having enough to eat, but why are they not having enough to eat? And so what the administration is trying to do is to provide aid and make structural changes, as well as investments that will result in an economic recovery that is shared, that's inclusive, and that's just. So with the FY23 budget that was just announced, along with a whole slew of other mechanisms like the American Rescue Plan, the president is proposing major investments in core needs that will hopefully reduce food insecurity by addressing drivers. So for example, investments in childcare, investments in healthcare, housing, job training, education. All of these have the potential to relieve that underlying problem, which drives food insecurity. And so just want you to know that one of the things personally that makes it so exciting to be part of this administration is that there's a real top-down emphasis on how do we not just try to solve these major social issues, one of which is obviously food insecurity, but how do we also get at some of the underlying problems so that we're not just doing Band-Aid solutions, but that we're really trying to take a holistic view to helping people and have it not just be one-time help, but have it be more of a systematic change.
That's really helpful and encouraging to hear, and appreciate the focus on the more comprehensive approach, because we all know that nutrition is oftentimes just the byproduct of a lot of other things going on in people's lives. So really appreciate that context, and really exciting that hopefully to see that cross the finish line, but it's a few more steps to go. One of the other questions that we've gotten, and I know I've heard a lot about as well, is there's certainly a lot of buzz about the White House Conference on Food, Hunger, and Nutrition. It's been a while since the last one, over 50 years. Any insights on the conference planning and how healthy eating research and grantees and working groups can be most helpful to you and others in the administration in planning that?
Yeah, great question. And we'll give a bit of a lackluster answer because there's only so much that I can share at this point. But in broad strokes, the FY22 budget allocated $2.5 million directly to Health and Human Services to convene the White House Conference on Food, Nutrition, Hunger, and Health. And this is about 50 years since the last conference, which was such a landmark for so many of the programs that we're talking about now. What will also happen is that HHS, along with many others, will be developing a final report using a whole of government approach. There will be more information coming on the conference after there is an official announcement, but until there is, we cannot get ourselves ahead of the White House. What I would say in terms of, how can you get involved? I would stay tuned for more information about the meeting. And there should be direct ways to think about involvement. At the very least, hope that you all can tune in. We don't know yet if it's going to be web streamed or whatever, but I think it's going to be a really interesting opportunity to, as a country, to be thinking critically about these core issues that are so important to obviously people around the country, but also to all of you and the work that you do on a day-to-day basis.
Great, good to hear. And we will wait with bated breath. One of the questions that we've gotten, and it kind of relates to the funding announcement that was made last week with the collaboration between the Economic Research Service and the USDA. We know under the previous administration that ERS had some pretty significant changes, and it changed its national office. Do you see any of those reverberations from that significant shift impacting their ability to conduct the research in a robust way that we've all come to, frankly, know and respect?
Yeah, so we'll say that because I sit in the Food Nutrition Service, my line of sight into the Economic Research Service is limited. What I can say is that while yes, it is definitely the case that the ERS staff got reduced by quite a bit during the last administration, a couple of things are happening. One is that there's a big effort to rebuild the workforce that is both within ERS, and this is across USDA, and that there's still lots of important work that's coming out of that shop. So hopefully you all are signed up for the charts of note and other things that come out of the Economic Research Service. The other thing just on this issue of job force creation, I want to flag is that the Food Nutrition Service is hiring hundreds of people over the coming years. And in fact, when the secretary was giving the speech in New York, he must have said this like 6 times. We've gotten all these emails from people about, well, where do I look for jobs? So I would say that for those of you who are considering working in government, there are a lot of opportunities right now in the Food Nutrition Service. And it could be a really interesting way to bridge the policy and the research world. And I can just say from personal experience that this is my second tour of duty at USDA. It's just a wonderful place to work. It's very much, it feels very public healthy in that it's very mission-driven people that care a lot. Tracy knows the organization really well too. And I'm guessing we can both agree that USDA it's a great place to call home.
It is, and it is my second gig at USDA as well. And one of the main reasons I came back was because of the nutrition position, and because I love the agency. It is just a great place to work. And again, that's not saying anything about any other government agency, because other than the Navy, I haven't worked at any other one. But one other last question, and I just haven't heard much about this, but we do get questions about this, and that is there any possibility that USDA will work with the FDA, CDC, FTC, and possibly reinvigorate some of the food marketing work that was going on in a couple of administrations ago, as you well know? Is there any talk of reinvigorating some of those efforts in terms of addressing marketing to kids?
Yeah, the answer is I don't know, but I can say a few things about marketing because it is an important question. So there have been some changes at FNS which have the potential to make an impact. So for example, I mentioned that there were some changes to SNAP-Ed. And what that has taken the form of is there's now a new nutrition education branch in SNAP to support SNAP-Ed. It's going to have improved data collection. There's also going to be a national system for reporting. And the key thing in the context of food marketing is that there's going to be encouraging maximum flexibility in the use of policy, systems, and environmental change approaches, which I think, as we all know in this virtual room, it's one of the most effective ways to promote behavior change through information. And so that's one vehicle where there might be a way to positively impact children. Now, certainly there's a much larger food marketing environment that this pot of money from SNAP-Ed can't reasonably compete with, but it's an important shift in how SNAP-Ed is looking to deploy those dollars that can potentially have a positive public health impact. The other thing that's worth pointing out to this audience is that there are local school wellness policies, and those are required to include policies for food and beverage marketing that allow marketing and advertising of only those foods and beverages that meet the smart snacks and school nutrition standards. So that's just one more thing to have on your radar. But I would say it's a really important question, one that I know many of you are thinking about, and I would just stay tuned for more and be thinking about important research questions that can help inform the policy process as you consider some of these really big wedge issues in the public health nutrition world.
Right, that's a good point in terms of the shifting the focus, or at least shoring up the PSE work in SNAP-Ed. So it's great to hear. Thank you so much, Sarah, for joining us today. We will share any of the unanswered questions, and there were a few that did come in that we weren't able to get to. We'll share them with you, and then you can be in touch with Healthy Eating Research to see how we can respond to the remaining ones. But again, we really appreciate you taking the time to join us. And of course, best of luck. We are excited about hearing the great things that are coming out. If anybody is interested in any of those positions that Sarah mentioned, just log on to USA Jobs, set up account, do a search, and you'll get an email every few days telling you it's available. So I know I could speak personally, would love to have you in our ranks. So again, thank you very much, Sarah. And now we are going to transition to our second component of this session today. We have a great lineup of speakers. Most are familiar to the healthy eating research community on this policy panel. We definitely have a new addition, and between them all, the participants are guaranteed to walk away equipped with a really good handle on what's hot and happening in the policy realm on a number of levels. I am going to introduce them individually right before their respective presentations. The first up is Colin Schwartz. Colin is Deputy Director, Federal Affairs for the Center for Science and the Public Interest, and he works on nutrition policy and advocacy. He is CSBI's lead lobbyist on basically everything from school meals to the Farm Bill, soup to nuts. He also facilitates the National Alliance for Nutrition and Activity, the nation's largest nutrition advocacy coalition. Colin's going to be providing the federal update today, and welcome, Colin, and I'll turn it over to you.
Great, thanks, Tracy. Hi, everyone. Happy Friday. Thank you to HER for having me. I'm excited to be on this esteemed panel. So I'm Colin Schwartz with the Center for Science and Public Interest. CSPI is a 50-plus-year-old evidence-based consumer advocacy nonprofit. We've been working to improve the food environment to make it easier for everyone to eat better. We don't accept any government or industry funding to remain impartial and objective in our work. And we also lead the nation's largest coalition on nutrition called NANA, the National Alliance for Nutrition and Activity, which has over 500 organizations. So I have the pleasure of giving you all an update on what's happening at the federal level for the next 15 minutes. So let's go to the next slide. So the first question is, what has Congress been doing these past couple of years or not? You'll see since the beginning of the pandemic, Congress has passed multi-trillion-dollar packages that provided significant relief to families and individuals and investments in our public health infrastructure. This relief has largely helped people remain out of poverty. That's a good thing. For instance, providing free school meals since March 2020. There was an increased emergency allotment for SNAP, which then luckily we were able to transition to the update to Thrifty Food Plan, which Dr. Bleich talked about, in addition to a number of other supports such as boosting unemployment insurance, increasing the child tax credit, subsidizing health insurance premiums, and housing assistance, and so on. And thanks to these bills, overall food insecurity levels stayed the same, but for kids, it actually increased, and food insecurity among Black and Hispanic households compared to white households have widened. Rates of weight gain also increased during the pandemic among kids compared to before the pandemic, which we know put kids at greater risk of diet-related disease in the longer term. And we've already talked about how COVID hospitalizations were related to people with diet-related disease. So the last time Congress passed a big stimulus package that was really related to health was the American Rescue Plan. And that's been nearly over a year ago. And notably absent from this list is a Build Back Better Act. So What does this all mean? The absence of Congress continuing to extend or increase relief has meant a lot of this relief has in fact ended, like the increased child tax credit or health insurance or housing assistance, which has helped a lot address some of the disparities that communities of color face due to the structural racism that Dr. Bleish talked about. Also, many of us in the advocacy community were a bit stunned when the latest package passed by Congress, the omnibus spending bill, didn't extend USDA's ability to serve free school meals and serve meals more flexibly. Next slide. So as mentioned, millions of kids are at risk of losing access to summer and school meals. We, of course, are going to continue to push for this in standalone legislation and future vehicles. Also, many states are working on healthy school meals for all, which has been terrific in the absence of congressional action, like in Maine and California. And this is an area ripe for state advocacy, which I think Jim will talk more about later in the panel. There are some bright lines, however, in the FY22 omnibus. We've talked about the plus up for WIC fruit and vegetable benefits, which will reach more than 4.75 million women and kids. There's also, for the second time ever, dedicated funding to help schools meet the meal standards through technical assistance. There's also, for the first time ever, dedicated increased funding for SNAP Ed technical assistance. And we've mentioned the White House conference. The bill does provide some funding for that. And we've talked about the timing is sort of unclear when the conference will happen, but HHS has to issue a report on initial findings by mid-July. There are also still policy riders from the food industry. No surprise here. There's a rider that allows more potatoes to be served in the school breakfast program. There's a rider that stops SNAP retailers from meeting stronger stocking requirements for healthy food. And lastly, there's been a decades-long rider that stops the FTC from developing voluntary industry recommendations to reduce junk food marketing to kids, which Tracy mentioned. Next slide. So what's coming up, or what does Congress have to pass? This year, they have to pass a spending bill, the FY23 bill, and we'll talk more about that. But that's essentially it, and that's likely going to be pushed after the midterm elections. There's, of course, child nutrition reauthorization and the Farm Bill. Child nutrition reauthorization is looking less and less likely, but we'll see if it happens this year. As you all may or may not know, the last time Congress passed a CNR was in 2010. That was the Healthy Hunger Free Kids Act. The Senate has already begun looking more toward the Farm Bill rather than CNR, with field hearings this summer, and that doesn't have to pass until fall of 2023. The Democrats are still trying to pass a Build Back Better, so we'll have to see what the latest, greatest version of that is and what it's going to be called. And there's now a push for a COVID supplemental for additional relief, so we could see that potentially passing soon. Next slide. So I do want to take an example of the advocacy community's general priorities in one area, like child nutrition, and compare that to what Congress could in fact do. So these are priorities developed by the NANA Coalition, which CSBI convenes, falls into various buckets like increasing access, maintaining and strengthening nutrition, providing financial supports to schools, improving the school food environment, and on sovereignty for tribal communities, which Aaron on the panel will talk more about later. Some of these are higher priority and some are more expensive than others. So let's talk about which of these could happen in which vehicles. Next slide. So one vehicle is the Build Back Better Act, or whichever iteration it becomes. Build Back Better is legislation based off the White House's American Families Plan. And Build Back Better has great promise and had great promise for providing significant expansions for meals, among other supports. So I want to point out that while Build Back Better can do a lot, it's already starting from a limited place, and this isn't so much a criticism as it is a reality. So for instance, the original proposal for Build Back Better is not truly healthy school meals for all, in the sense that all students who attend schools that participate in the meals program would get a free meal, but expands it to essentially cover the number of kids who get reduced price and the number of kids who pay for the school meals, which is that 9 million ballpark estimate. The White House also proposed $1 billion to help schools in buying and preparing healthier meals. Congress took this proposal and split it so that of the $1 billion, then some went to demonstration projects and some went to kitchen equipment grants. And then in the latest version that was passed by the House and stalled in the Senate, that was pared down even further, the number of years kids would be covered for expansion of access. And that $1 billion instead ended up $250 million for schools to support healthier meals and $30 million for kitchen equipment grants. Next slide. So this is just to show that the priorities that are covered by Build Back Better are bolded, recognizing some caveats like healthy school meals for all isn't truly healthy school meals for all, but a significant expansion in the right direction. And all the other ones that are not bolded are not included in Build Back Better, and so would have to be included in other vehicles like child nutrition reauthorization. Next slide. So I'm also going to briefly share some of the highlights from the president's budget so that you don't have to read the hundreds of pages yourself, which was released last month and which Congress will take into account when writing their FY23 bill. But again, it's proposed. It's not necessarily what Congress will fund. And I'm really only going to focus on USDA and FDA, some of which we've touched on already. Next slide. So we've talked about the 23 million initiative on nutrition security, education, and racial equity that Dr. Bleich mentioned, which is very exciting to see. And again, that funding falls into 4 general buckets. The budget details it would fall into supporting research and evaluation, leveraging partnerships, targeting underserved communities with culturally appropriate resources and interventions, and improving access to USDA nutrition education resources. There's also investments in nutrition research, like for research grants and USDA studies, and rebuilding USDA's workforce on research, which we've talked about, like filling those vacant positions from the Economic Research Service that was moved to Kansas City, Missouri. And it's wonderful to hear about this new collaboration between RWJF and ERS. The budget does, in fact, actually say aggressive recruiting to fill in a lot of these positions that were lost due to the brain drain during the Trump administration. It's also wonderful to see a continuation of the WIC benefit bump and TA for school meals. There's funding for case management and a communications portal for SNAP Online. It continues that SNAP Ed Plus up for TA. It increases funding for scientific integrity of the dietary guidelines and developing a healthy eating index score for kids under 2, and also updating the HEI score with the 2020 dietary guidelines. And I just want to note that not in the budget are any proposals from the American Families Plan or Build Back Better or additional COVID relief. And there has been the recent proposal from USDA as part of the Nutrition Security Initiative for $100 million to incentivize healthy school foods. So potentially we've gone from 1 billion to now maybe 100 million, but that also was not included in the budget. Next slide. There are also modest increases to FDA's budget for healthy and safe food, which I'm happy to talk more about if people are interested. The CDC and NIH are largely flat funded for the areas that we work on. For NIH, there's still the ongoing effort to establish a national institute on just nutrition. But for now, there's an Office of Nutrition Research that was established in 2015 and was moved from NIDDK to the NIH Office of the Director. Next slide. So one thing that I want to highlight is that this year is an election year. We talk a lot about policy and our priorities, particularly for this session. But a larger issue, quite frankly, is having the right people in power and enough of the right people in power. So many pundits and experts are predicting that the House will flip from Democrat to Republican control. In the House, it will only take a net change of about 5 Democrats to lose their majority. There are many more vulnerable Democrats than Republicans. In the Senate, it's unclear what will happen. But just note that if Democrats want another bite at the apple for budget reconciliation, which is Build Back Better, or essentially a package that could pass with just 50 votes, they need to maintain that 50 vote count. And if they lose it, they might try to move something during lame duck. We'll have to see. But other than passing legislation in the Senate, it doesn't change. You always need 60 votes, at least in the Senate. So for child nutrition reauthorization or a farm bill in 2023, whether the Senate flips or not, you still have to deal with that same calculus of 60 votes. And then something that's not on this slide is that there are roughly 7 toss-up governor races this year, and most of those are from vulnerable Democrats. Next slide. So speaking of people in power, what can the White House and the federal agencies do? So the administration launched its working definition of nutrition security, which Dr. Bleich talked about, which has been wonderful to see. Some of the things that I again want to highlight, this list is not all inclusive, are updating the school meal nutrition standards with the 2020 dietary guidelines, which we are advocating that USDA set schools and the food industry on the right course toward sodium and whole grains, but then also for the first time ever establish an added sugar standard for school meals. And while we've made a lot of progress, school breakfast is still far too sugary, with many products, as you can see on the right, served at breakfast. And as a meal, say your sugary cereal combined with chocolate milk can easily exceed a young kid's day's worth of added sugars. There's also that 100 million for healthy school meals in as part of the nutrition security initiative, but it's not included in the budget. There's also updating the WIC food package. There's work underway for SNAP Online, which was established in the Farm Bill, but USDA is also working to expand online ordering and transactions for WIC Online, which has been mentioned. And then, of course, the Thrifty Food Plan updates. And then for dietary guidelines, the 2025 DGA comes out at the end of 2025, and USDA is looking to go from a population-wide approach to one that takes into account specific subpopulations and life stages, or at least add that to maybe the next iteration of the dietary guidelines. So we could potentially see different healthy meal patterns for different communities and ages. And there are also priorities for tribal communities, which Erin will talk about later. And then next slide. So other big, bold ideas. The first on the left would be actually having food labeling in our country that would tell consumers how healthy or unhealthy their food is, like a traffic light symbol or warning symbol that has been successfully implemented in other countries like Chile. The second in the middle would be to reform the anti-competitive food environment that stacks our food choices for us with junk food all throughout the store and in prominent areas of the store. We at CSPI have asked FTC to look into these practices. Also, part of this is making sure communities of color and lower income communities and rural communities have access to the healthy food in their community, and it's easily accessible and affordable. There are a lot of solutions here, but one thing that could help, and that I mentioned earlier, would be to remove the rider that stops SNAP retailers from providing healthier foods. And USDA could work to have SNAP be a catalyst rather than a barrier to increasing healthy foods for particularly smaller food retailers in lower income neighborhoods. The Farm Bill could also explore ways in which SNAP retailers can improve the food environment through stocking and marketing of healthy foods and continue to increase and expand fruit and vegetable incentives. And then a third option on the right is a food supply-based approach to reduce, for instance, excessive amounts of sodium and added sugars in our food supply through a mix of tactics like front of package, which we would hope to see smaller portion sizes and reformulation, or warnings that products are too high in sodium or added sugars, or voluntary food industry reduction targets like what FDA came out with for sodium, but we are still calling on FDA to release the long-term sodium targets, and maybe also establish ones for added sugars. And then another is taxation, which Jim will talk more about for sugary drinks. Next slide. So I encourage you all to get involved with CSPI and take action. You can find out more online and find us on social. Thank you very much, and I'll turn it back to Tracy.
Great, thank you, Colin. I am always amazed at how you seem to have your finger on the pulse of so much happening at the federal level. So we really appreciate your insights and the work that you and CSPI and that the NANA Coalition do. So thank you. Next up is Dr. Jim Krieger, who will be providing the state and local policy update. Jim is Executive Director of Healthy Food America and clinical professor at the University of Washington Schools of Public Health. He supports policy change to promote healthy eating and health equity through research, providing technical assistance to policymakers and advocates, and doing direct advocacy work on school nutrition, menu labeling, and sugary drink taxes and marketing. That's just to name a few. So with that, Jim, I'll turn it over to you.
Great. Thank you, Tracy. It's great to be here with everybody today. And thanks to HER for hosting yet again another inspiring annual meeting, hopefully the last virtual one. Maybe we'll be together next year. And thanks for inviting me to be back on this panel. And it was great to hear Sarah and Colin's presentation on federal policy. I'm going to turn to state and local policy. State and local governments can build on and advance federal policy, and they also have the opportunity to innovate and pursue additional policies. Keeping up with all that's going on across the country, there's so many places doing exciting and important work is challenging, but I'll try to give some highlights. I'll talk about some of the most active policies, others that are likely to have a substantial impact, and yet others that are emerging. Next slide. So here's a list of some of the policies that are in play, and I'll mention those that are in bold here. The chat has links throughout my talk to resources to learn more about the range of policies that are out there. In addition to the grouping by the A's of marketing that I've done here, it's also noteworthy that these policies tend to fall in two buckets, one that focus on the downstream consumer, retail, or process end of the food value chain, others that address the upstream food production end. And the researchers and advocates working in each of those domains don't necessarily interact maybe as much as they could. They're often in parallel universes. But it has to be about both healthy eating and nutrition and changing the food system so that it's sustainable, carbon neutral, and just. And so one takeaway is looking at what we can do as researchers to make those connections and connect those dots. Another thing is that it can't just be about accessing healthy food, which is critical, but also reducing exposure to unhealthy, ultra-processed foods and all its marketing that big ag and big food dominate in our food system. So think about ways that you can bridge these areas. Next slide. So as Colin mentioned, the first policy I'll talk about is sugary drink taxes. In my estimation, it's one of the most powerful policies to emerge in recent years. There are currently 7 local jurisdictions, 1 tribal nation that tax sugary drinks in the US. And while it's been about 4 years since a new tax has been implemented here, there are quite a few in the works. In 2021, there were 10 state bills introduced and 1 came close to passing. That's the most in any year. The norm is that bills require multiple introductions over several legislative sessions before they pass. So I suspect that as federal COVID relief funds dry up and cities and states are looking for more revenues to replace the loss of these funds, they'll be looking to SSB taxes as a new revenue source. Next slide. Globally, there's a really different picture in terms of progress. More and more nations are implementing taxes, 50 plus and growing. The World Health Organization, Pan American Health Organization, others are actively promoting them now. Next slide. So really what's changed since our last time together a year ago is that the evidence that taxes are work has been rapidly expanding. There are now several meta-analyses that have been published. This one by Lisa Powell and her colleagues focused on US taxes and found that after tax implementation, demand measured by sales, purchases, or to a lesser extent from consumption has fallen on average about 20%. Price elasticity is minus 1.47. That means for every 10% increase in the price due to tax, the demand drops by 15%. That's a pretty big population health effect. Next slide. Evidence is also emerging to counter industry's criticisms of taxes, particularly that they are regressive and lead to job loss. In an analysis done by Jesse Jones-Smith at University of Washington, myself and our colleagues Melissa Knox, Norma Coe, and Lena Walkinshaw, we assessed the financial burdens and benefits of these taxes by income level. And we found that while lower income populations do pay a very small but higher percentage of their income in taxes, there's no difference in absolute spending on beverage taxes per capita. And more importantly, the taxes have resulted in sizable net transfer of funds from higher to lower income populations. People with lower incomes in aggregate paid less in taxes, and they receive greater benefits from revenues invested in programs funded by the taxes. Next slide. Another concern is, will people switch to untaxed sources of sugar, substituting, thus negating any net tax effects on added sugar consumption? New evidence is showing that if this is happening, it only has small effects. Powell and colleagues use a difference in difference approach, for example, shown here, to compare the changes in the amount of sugar sold in Seattle and the control city of Portland from taxed and untaxed products before and after the tax took effect. Sugar decreased 23% in Seattle overall, but net reduction of 19% after taking into account substitution effects. Next slide, please. And finally, evidence is beginning to emerge on health outcomes. Mexico was an early sugary drink tax adopter in 2014. And a recent study found that in cities where the price of taxed beverages increased by at least 10%, prevalence of overweight or obesity among adolescent girls declined. A second study showed a decline in cavities as well among both adults and kids. So we're beginning to see the health benefits documented from taxes. Now, next slide, as I'll move on, I'll talk about school meals, whereas Colin already talked about, and Sarah as well. There's powerful influence of federal policy. States, cities, and school districts have also adopted policies that complement or go beyond the federal policies. I list some of them here on this slide and some of the associated research questions, but I'll go into a few of them in more detail. And in breaking news, as I prepared these slides, New York City just released updated food standards for all city agencies, including schools, and they go beyond the USDA requirements for looking at added sugars, sodium levels, and whole grain standards. And notably, they recommend sourcing food locally, grown with regenerative agriculture practices, and low or no pesticides, a good example of integrating nutrition, climate change, and environmental goals. Next slide. We've seen innovation during the pandemic in school meals. Schools offer grab-and-go prepared meals for off-site consumption, and some cities made meals available to all family members. State agencies also use the Pandemic Electronic Benefit Transfer program initiated by USDA, which sent debit cards which have cash to make up for missed school meals so families can buy food. These approaches are a model for providing year-round meals, and the policy should be extended. An evaluation of PEBT just completed by Eric Kenny, myself, and our colleagues suggests that it reaches nearly all low-income students, 89% of them, and costs relatively little per meal provided. Grab-and-go meals serve fewer children at larger cost, but was able to reach children not eligible or able to participate in PEBT. So promising policies to move forward, as Colin noted, at the federal level. Next slide. As Colin mentioned, a policy to provide universal free school meals is in play. States and cities and school districts, however, are not waiting. Some have implemented their own free meals for all programs like New York, Houston, Maine, and California. Also, students that enroll high proportion of children from low-income households can participate in the community eligibility program through USDA and offer free meals to all programs. The box on the left shows how this enrollment in this program has been increasing since it began in 2014, but participation is uneven, as the map shows, and 68% of eligible schools only have adopted community eligibility. So there are state and school district policies that are coming into play to require participation in community eligibility. For example, Virginia passed a bill in October that requires participation, and Massachusetts is considering a similar bill. Next slide. There's also a flurry of policies aimed at increasing provision of plant-based food in schools. This is a great example of policy bridging the gap between enhancing nutrition and reducing the carbon footprint of the food system, which contributes up to 1/3 of all greenhouse gas emissions. The California Assembly, for example, passed a bill which is now in the Senate that provides up to 20 cents per meal for vegan or veggie foods, and New York State has a similar bill in committee. New York City's mayor has just issued an executive order that added a second meatless day, this one Vegan Fridays, to their meatless Mondays. And many other school districts ranging from Miami to San Diego have done similar actions. Next slide. State policy is building on the foundation of federal food security policy. SNAP participation rates vary, as we've heard, widely across states, as shown in the map here. Some states would then have implemented flexibilities to try to expand enrollment in their states, such as doing away with mandatory job training or search requirements, or adopting more aggressive outreach and enrollment policies. For example, there's been an increased focus on food insecurity in college campuses, where some estimates show that 1 in 3 students are food insecure, although more research is needed to understand the true extent of this problem. California and New Jersey have passed bills supporting campus programs for outreach and enrollment for SNAP, and there are now 7 pending bills in current legislative sessions. Next slide, please. We talked about warning labels last year, and there hasn't been any progress on requiring them in the US for advertising or packaged foods, although many countries around the world, particularly in Latin America and also in Israel, have adopted the policies. You might remember San Francisco passed a bill, but industry successfully challenged us in court, leading the city to withdraw it. But the door's not shut. What are needed are carefully crafted bills with clear statements from federal authorities like FDA or the Surgeon General to put the federal government on record as to the harms from health from sugary drinks. Next slide. But labels do have a clear potential for impact, as a lot of good research has shown, a lot of it funded by HER. There's a growing body of evidence from simulation studies that labels reduce choice of labeled beverages, as well as change attitudes and increase knowledge. The most recent study by Marissa Hall, Anna Grumman, and their colleagues show that graphic labels do indeed reduce choice. This adds to the prior evidence that icon labels work, but it remains to be seen if one is more effective than the other. But I would guess that icons are more politically and legally feasible. Next slide, please. A new approach is adding sugar warning labels to menus, building on the experience with calorie and sodium labels. New York passed a bill in December that requires warning icons on the menu or menu board items if they contain more than 50 grams of added sugars. And so we'll have to see how this plays out and other jurisdictions pick it up. Next slide, please. Another new approach that connects the dots between environmental and health impacts of food is plant-based food menu messages. In this pilot online study, a message placed on the menu about vegan options increased the proportion of vegetarian dishes that were selected from these menus. So we're looking at this one as another option for menus. Next slide, please. As we heard about at the Thursday session, marketing is one of the most powerful tools that the food industry wields. It's a major driver of food choice. There are many policies that are emerging to rein in marketing of unhealthy foods. Voluntary actions by industries have been less than impressive, as shown in the just released Fox report from the Red Center. Next slide. At the local level, London and Amsterdam have banned unhealthy food ads, high in sugar, fat, and salt, on their subways. And a recent evaluation of this local London policy, found a 7% decrease in weekly household calorie purchases using a controlled time series design at the population level. Pretty impressive for this policy. Maybe we can see some of this work happen in the US. Next slide. New York, considering its leadership in local food policy, just restricted food advertising on city property to only healthy foods. Next slide, please. One of the more pernicious advertising tactics is discriminatory or predatory marketing that uses deceptive claims and targets people of color and especially children. A new proposed bill in New York State grants permission for the state attorney general or cities to stop such practices by litigation and allows people or organizations to litigate as individuals for damages. Next slide. Going back to the UK, another recent policy there restricts the promotion of unhealthy foods at checkout aisles, store entrances, and end caps, as well as banning 2-for-1 deals and free refills. Some of this could happen through local or state legislation in the US as well. Going on to the next slide, in the US, several policies have been suggested to promote healthier food retail environments. And I think this work's only beginning, and it looks like a really fertile road to till, with Berkeley adopting an ordinance that allows display and promotion of only healthy foods at checkout aisles, for example. But much more work and much more research is needed in understanding how to make healthy retail environments healthy from a marketing perspective. Counter-marketing, on the next slide, while not a policy per se, unless it's funded through legislation, is also an emerging strategy building on work in tobacco. I recently published the findings of a study done with Christina Roberto that showed that fruit drink counter-marketing messages delivered online to Facebook's reduce parental choice of these beverages. A new study from the Red Center also showed that counter-marketing videos around sugary drinks and toddler milk change attitudes and intentions to serve. Next slide. We talked about kids' meals last year, and they remain a popular policy. Montgomery County recently adopted a more comprehensive version of kids' meal legislation that requires offering a healthy meal option as well as just a healthy beverage default. But the evidence thus far has not shown a lot of impact on beverage choice, and compliance has been limited where studied. Next slide. Let's skip the next slide and go on to the next one after that. There are many policies that focus on building local and regional food systems that are good for people and the planet, integrating efforts to address nutrition, address healthy food access, and reduce food waste. And I'll give you an example of a couple of these right now. Next slide. One area that's getting increased attention is food waste. Up to 40% of the food production from our country does not end up on the table at great cost to society and the planet. So there are efforts like the one in Washington State, which focuses on preventing waste, rescuing edible food, distribute to those who need it, and recovering and repurposing unused and unedible food materials. So one example are some bills in New York and other places that require supermarkets to have arrangements to donate excess food to food banks or mandatory food scrap recycling and composting. Next slide. The other thing, as another example, is the support that states and cities are providing through policy to development of food hubs that aggregate food from smaller local and regional farmers and make them available to institutional purchasers. So this is something I think to pay attention to as well. So in conclusion, my last slide, there's a lot going on out there. It's hard to keep track of it all. Given the scope of the issues surrounding healthy food policy, I encourage us to take a healthy, holistic systems approach and look at how policies work across the whole food chain. I encourage us to focus more intensively on policies that affect corporate behaviors, like marketing and product formulation, rather than placing the burden on consumers to make healthy choices on the food environment, indeed one that's created by big food and ag. And I encourage us to continue our focus on equity, both as a process and outcome, how we do our work and what the goals are. And finally, let's continue to look for approaches that generate benefits for both people and the planet and measure these impacts. True cost of food approaches like the one developed here by the Rockefeller Foundation can help us in this endeavor. So thanks for your attention, and back to you, Tracy, for the next speaker. Thank you, everybody.
Thank you, Jim. The work happening, gosh, internationally and at the state and local levels, that work is just so important. And as you mentioned, and I've seen all too well, oftentimes that work triples up. I can't even say the word. It's Friday, trickles up to really lay the groundwork for a lot of the federal policy that we see and that Colin talked about. So, and it's also interesting the impact that COVID has had on accelerating a number of the changes at the state and local level, and then really appreciate the increased focus on the intersection between food policy and climate change. I think that's going to be a growing area, hopefully in the future. Next up is Erin Parker, JD. Erin is the director of the Indigenous Food and Agriculture Initiative at the University of Arkansas School of Law. IFIA is the only national legal research and policy analysis center focused on supporting tribal governments exercising their sovereignty in the space of food and agriculture. Erin's worked in Indian country all of her professional career, and she also teaches courses at the University of Arkansas's Master's in Agriculture and Food Law program, including federal nutrition law and policy and indigenous food and agriculture law. Erin will be providing the tribal policy update. Erin, over to you.
Thank you so much, Tracy, and thanks everyone for joining us today and having me here. This is my very first HER meeting, so I'm excited to join you virtually, and I certainly echo Jim in hopes that the next one can be in person. It's been great to start slowly getting back out into communities. So next slide. I want to tell you a little bit about IFAI. We exist to be a resource for all 574 federally recognized tribes, 100 plus state recognized tribes, 80,000 native farmers, ranchers, and food producers all across Indian country for pretty much anything and everything you can imagine in food and agriculture. So, as you can imagine, our work is quite broad. Most relevant for today will definitely be our role as research partner to the Native Farm Bill Coalition, which is the largest national intertribal coalition of tribal nations seeking opportunities for Indian country in the Farm Bill specifically. Next slide. Essentially, our role at IFAI is to put tribal sovereignty in food sovereignty and produce work that empowers tribal governments who are expressing their sovereignty in the space of food and agriculture. Next slide. That's especially relevant to this update because I really wanted to start off my updates today by contextualizing for you tribal sovereignty in the space of health equity and nutrition. It's really going to ground my updates in this fundamental role as tribes as governments. And the foundational principle here is that tribal nations are sovereign nations. That means that tribal governments have an inherent right to regulate for the health, safety, and welfare of their citizens within their jurisdictions. It also means tribes have a unique relationship with the federal government, with whom tribal nations have a government-to-government or nation-to-nation relationship. That relationship can most clearly be demonstrated by the requirement for tribal consultation, for example, which comes from Executive Order 13175, and that requires federal entities to engage in government-to-government dialogue with elected tribal officials and federal officials before there's any kind of institution of a program, policy, regulation that has tribal implications. That's a really unique political right of tribes as governments to have that dialogue with federal officials, and it's a function of their authority and status as sovereign governments. That is really part of the federal trust responsibility as well that the federal government owes to tribal nations as a result of land cessions and treaties. Next slide. So today, as I said, there are over 600 Native nations across what is today the United States. And these are governments that have the ability to exercise their sovereignty over all matters, including health, safety, and welfare of citizens, which of course includes public health, agricultural production, and facilitating access to healthy, culturally appropriate food for their citizens. That's a function that tribal nations have absolutely fulfilled since time immemorial and certainly continue to do so today. The federal legislation that Colin referenced, particularly the CARES Act, offered tribes tribes an unprecedented level of support to invest in food systems. And so many tribes over the last couple of years have been using support like that to invest directly in their food systems. And that wasn't out of any kind of sudden acknowledgement of this need, because of course, tribal nations have long known that food systems and health equity for tribal communities were destabilized as a result of colonization. But with that final push of federal resources that tribes have been seeking for so long, fulfilling that trust responsibility as those started to come out through pieces of legislation like the CARES Act, then tribal nations were able to make those heavy investments in food systems that have been long needed. And that was, there was some significant investment, for example, I wanted to give one in meat processing. There were multiple tribally owned meat processing facilities that are federally inspected that have been opened after the onset of COVID. And those were entirely stood up during the pandemic by tribal nations. Those are providing support, not only economic development support for tribes and tribal producers, but they're also getting culturally appropriate meat products to tribal citizens or anyone living within tribal communities at reduced or no cost, because those facilities are tribally owned. So tribes are able to transport and move food around at a lower cost because it's not going over several hundred miles. It might be just going a few miles down the road. To provide a strong legal foundation for some of that work and related work in food systems that we've seen tribes investing in, we've also seen tribes creating entities within their governance structures, no matter what that looks like. With over 600 tribes, there's a lot of different governance structures, but whatever those are, we're seeing a lot of tribal nations creating entities that are housing their food systems efforts to give them legal stability long-term. And those are just some of the things that we're seeing tribes doing right now to express their sovereignty in the space of food and agriculture as a response to COVID, but also to prepare for the next crisis and the one after that. So that's a little bit about tribal sovereignty in a nutshell. And I did want to start briefly with that foundation before turning to policy updates, because several of the policy updates I wanted to share with you are really grounded in that reality of tribal nations as sovereigns, and involve some calls by tribal leaders to expand and enshrine recognition of tribal sovereignty directly in key federal legislation like the Farm Bill and Child Nutrition Reauthorization process. Next slide. Tribal sovereignty also extends to data sovereignty, which can be understood from a couple of perspectives. So one of those is native control of native data. That makes sure that tribes have governance over the data that tells the story of their communities, whether that's about their health, their foods, their lands, or beyond. And it's also about decolonizing data sets and ensuring that native people are seen in data, that they're not invisible, especially in federal data sets that are used to set national policy. There was an unfortunate reminder of that invisibility in key data sets during COVID-19 and the onset of it. Folks on my team at IFAI and folks with the Native American Agriculture Fund, NAF, and Food Research and Action Center, FRAC, discovered, much to our dismay, that the Census Pulse data, which was tracking household food insecurity during COVID, wasn't disaggregating data for American Indian and Alaska Native households. It was just folks were lumped into an other category who are identifying as American Indian and Alaska Native. So Native people and the food insecurity in Indian country was really left out of those important national snapshots. And to remedy that, NAF, FRAC, and IFAI came together to do some household level survey sampling on our own to at least offer some visibility into what was happening in tribal communities during this crisis. The report on that work was released a few months ago, and I think some of you have probably heard some of us talk about it already, but I'm going to share a little bit of top-line data from it now, just as a preface to the policy updates that I have, because these data are really informing policy priorities for the Native Farm Bill Coalition and other orgs as we move forward. Next slide. Generally, what we found was that what I think a lot of us working in Indian country already knew, and that's simply that food insecurity in Indian country is too high. Overall, 49% of respondents to the survey reported experiencing low food security. And if you look at some of the other national data sets that were coming from a similar time period, you'll see highest rates there measured hitting around 38% in similar household surveys. So what was reported here in this survey was much higher than the national rate. And of that 49% of folks who were reporting in saying they were experiencing low food insecurity, we've got some other top line data here on the screen talking about the number of those folks who were indicating that they were skipping meals, that they couldn't afford to eat balanced meals, and similar data points. I do want to go ahead and skip to the next slide because I do want to get to the policy piece as well. So with those data in mind, let's turn to policies that can address some of those disparities. So as I mentioned, IFAI is the research partner to the Native Farm Bill Coalition. Next slide. The Native Farm Bill Coalition is composed today of over 200 tribal nations, intertribal organizations, ally organizations, all of which came together back in 2017 to look at opportunities for Indian country in the 2018 Farm Bill. There were over 63 positive tribal-specific provisions included in that final bill, and that was a really historic moment for Indian country agriculture. Heading into Farm Bill 2023, or it might be 24. We've heard some chatter that it might be 24, but we're assuming it's going to be 23, and that's the work we're doing. The Native Farm Bill Coalition has really put the band back together, and we're currently preparing priorities for the next Farm Bill. Next slide. We are sorting our priorities for the next Farm Bill as the Native Farm Bill Coalition into three major buckets. Those are increasing tribal parity, expanding tribal self-governance, and increasing technical assistance for tribes and tribal producers. A couple of points of note here to highlight under parity, particularly looking at the dual use of SNAP and FDIPR benefits. This is a change that would have to be made in a Farm Bill by Congress. Currently, it's participants in the food distribution program on Indian reservations and participants in the SNAP program. If they're tribal citizens who qualify for both, they cannot use both programs in the same month. That is a statutory prohibition that Congress would have to change. A lot of folks in Indian country think that that's somewhat archaic, and it really reduced food assistance opportunities for tribal citizens during COVID-19. The inability of folks to participate in both, if they qualify for both, I will say, also caused, I know, some big anxiety for tribal citizens who were on FDIPR but were qualifying for PEBT. Unfortunately, people were really concerned that they were accidentally committing fraud because things were just automatically being issued as a matter of certification by the state that they lived in. So I know some FDIPR sites who got some pretty panicked calls for participants worrying that they were not actually eligible for this, and then it might get them kicked off of FDIPR, which is never something that you want someone who is struggling with food insecurity to worry about. But I mean, as somebody with a lived experience of hunger, I know how that feels. But it's definitely during the middle of a pandemic. It's not something you want someone to be concerned about. So improving parity through fixing problems like that is definitely something that could change in the Farm Bill. So is tribal administration of more programs, specifically here, the tribal administration of the Emergency Food Assistance Program. Tribes are not legally able to administer that program directly. And one of the things that we saw in that hunger report that NAF, FRAC, and IFAI did was that food access points of tribal citizens really shifted during this time of crisis, where tribal citizens were really relying on their government and the programs that their government was running. So in times of crisis, especially, access to tribes being able to administer programs directly connects more people with the food assistance that they need. Under tribal self-governance authority, also I do want to highlight 638 authority. I could talk about this all day, but I know I only have 5 minutes, so I'll be brief. In 1975, Congress passed a law that facilitated the taking over of certain programs, functions, activities, and services of federal programs by tribal nations using federal dollars as an acknowledgement of both tribal sovereignty and the trust responsibility that I mentioned that the federal government owes to tribes. That allows tribes an acknowledgement of tribal sovereignty, enables them to run programs directly for tribal citizens. It can be run in a more efficient way, a more culturally appropriate way. That law never applied to USDA programs until 2018. And one of the changes the 18 bill made was expanding self-governance to tribes by enacting a 638 self-determination contracting program for FDIPR, the food distribution program on Indian reservations. So expanding that is something that tribes have called for a while, because it is a 47-year-old law. Even though it's brand new to USDA, it's been pretty tried and tested as an acknowledgement of tribal sovereignty. And I think tribes know that and have expressed to USDA before that running those programs through 638 contracts or similar is an important expression of their sovereignty. Turning very quickly to CNR, as Colin mentioned, tribal authority to run all of the child nutrition programs is a priority. I do agree it's looking less and less likely this year, but nevertheless want to hit a couple of points. With a few exceptions, like the WIC program, tribal nations are pretty much excluded, unfortunately, from authority to directly administer most CNR programs. So changing that is an important priority. Next slide. The major vehicle for that change would, of course, be CNR. Congress has previously expressed support for this through the Tribal Nutrition Improvement Act, which was last introduced in 2019, but of course didn't advance when CNR didn't. The Native Farm Bill Coalition endorsed that previous iteration. It would have provided universal meal service for Native American areas, universal free lunch and breakfast, and it also would have made those changes to enable tribes to run some of those key programs. Next. Really quick updates from the administration. A big one here in November, Secretary Vilsack committed all of USDA to expanding tribal self-governance opportunities across the department. And although to fully realize that promise, it's going to require some congressional action, likely through the Farm Bill, through 638 authority or similar. This was really the strongest acknowledgement to date, I would say, that USDA has ever made from the Secretary's Office of Tribal Sovereignty. So it was pretty significant. And I know folks in Indian country were appreciative of that effort by Secretary Vilsack. There's also the Equity Commission that USDA sat earlier this year, and that's intended to look across all of USDA programs and authorities to ensure that participation is equitable and that folks aren't being left behind, specifically historically underserved communities, and that includes all of Indian country. There are Indigenous representatives on that commission. First is Tony Stanger McLaughlin, who's a citizen of the Colville tribe and the CEO of the Native American Agriculture Fund. She's on the Equity Commission proper. And then Carrie Jo Lawrence, who is a citizen of the Mandan Hidatsa Arikara Nation and the executive director of the Intertribal Agriculture Council, is on the Agriculture Subcommittee, along with a really strong Indian country ally in Sarah Vogel, who was one of the lead class counsel on the Keep Siegel case that was finally settled a few years ago. Efforts, of course, continue on the FDIPR self-determination project that I mentioned. Currently, there's $3.5 million in contracts in Indian country to date for tribally procured foods for the FDIPR program. That's never happened before. There's 8 contract holders out in Indian country currently on this program. There was $3 million included in the FY23 budget to keep that going. It is discretionary funding, so it does have to seek annual approps. The projects are super exciting that are happening with that program. I could definitely talk about that all day, but I'll just say there are tribes that are, for example, sourcing the entirety of the fresh fruits and vegetables offered for that program, sourcing often from their own tribal farms and tribal producers. There are more traditional foods and culturally appropriate foods making their way into the package because of this. So it's been really exciting to see tribal leaders' calls for those things finally realized in this provision and the contracts that are out there in the world. And of course, like so many of us, we're watching the White House Conference on Nutrition with great interest and opportunities for intentional inclusion of Indigenous voices in all aspects of that conference, including the report. And I know my time is up, so I will pass it back to Tracy. Thank you so much, everyone.
Erin, thank you so much. With my position at USDA, I've been honored to be working on the food distribution program, Indian Reservation program, and so appreciate your perspective and the work that you and your organization are doing on behalf of tribal communities. And it is really encouraging and invigorating to see the increased emphasis and focus on tribal communities is so important. And our final speaker, certainly last but not least, is Dr. Kristen Cooksey-Stowers. Kristen is an associate professor at the University of Connecticut, Department of Allied Health Sciences and Red Center for Food Policy and Health. She has a strong background in health equity, agriculture economics, public policy, and medical sociology with a focus on dismantling structural racism and reducing diet-related health inequities by improving food environments through policy solutions. Kristen will be discussing health equity in research and policy. And Kristen, I turn it over to you.
Hi, everyone. Thank you for that introduction, Tracy. And a huge thanks to my co-panelists for excellent presentations so far on federal, local, and tribal policies. And last, a huge thanks to HER for inviting me back to participate in this panel. I really look forward to the Q&A. Today, I will be discussing how we can advance equity by building on community capacity, getting to authentic resident engagement in food policy and research. Next slide, please. So here's just a roadmap of what I'll cover today during my time. I'll briefly share a theoretical framework on the policy process. Second, I will share 2 tools for applying authentic resident engagement in food policy and research. Afterwards, I will show how authentic resident engagement ties back into our broader goals around building on community capacity and ultimately advancing health equity. I will end by sharing some of what I'm learning while conducting CBPR research in the North Hartford Promise Zone, aligning with local proposals, targeting policy systems and environmental changes, and local residents' efforts to combat structural racism. Next slide, please. So this is CDC's theoretical framework outlining the key stages of the policy process, ranging from problem identification, analysis, strategy and development, enactment, and ultimately to implementation. I want to stress that this process is rooted in stakeholder engagement, like communities and its residents. This framework calls us to implement communication strategies and deliver relevant messages and materials, but to also solicit input and gather feedback. This framework highlights evaluation as an overarching theme across all phases of the policy process, including evaluating how stakeholders like residents were included. Thus, this framework motivates us to ground ourselves really in stakeholder and community engagement as we embark on tackling these major issues like nutrition security via policy. Next slide, please. This is the first authentic resident engagement tool that I will share today. It was created by the USDA-funded Healthy Food Policy Project, a collaboration between us at the Rudd Center, the Public Health Law Center, and Vermont Law School, and honestly was largely inspired by our National Advisory Board, including folks like Reverend Dr. Heber Brown with the Black Church Food Security Network, and Palmer from Center for a Livable Future, and Lauren Lowry from the National League of Cities. The ultimate goal of the tool was to apply authentic resident engagement principles to food policy in particular. The guide can be downloaded directly from the HFPP website. It links directly to Praxis Project's self-assessment tool for organizations or programs to reflect on the ways in which they embody health justice and racial equity in practice. And the site includes a webpage on resident engagement in action featuring the resident group I partner with in North Hartford. I'll go into more details about their work during the case study section of my presentation. Next slide, please. So the Healthy Food Policy Project team came up with this definition of authentic resident engagement, defined as an inclusive process for informing, designing, implementing, and evaluating food access policy changes that centers community residents. By inclusive here, we mean moving beyond participatory practices and acknowledging the longstanding deficiency by policy and advocacy organizations, government and public health officials, and others to embrace the capacity, knowledge, and experience already present in dynamic and resilient communities. So in continuing to build back better, we should remember to build on community capacity. This requires an intentional commitment to not only support those most affected by structural inequities, but to defer to them as much as possible. And reflecting on Wednesday's session on equity and yesterday's session on food addiction, I've deeply appreciated the thoughtful discussions around social determinants of health, fundamental causes of health inequities, and intersectionality so far. I see authentic resident engagement as an incredible opportunity for us to understand the complex pathways to inequities that we haven't fully explored, researched, and understood as a healthy eating research field, including history, culture, language, citizenship, gender, homelessness, or land access, just to provide some examples. Next slide, please. The HFPP Authentic Resident Engagement Tool features 4 working principles for authentic resident engagement. You can reference the website for more in-depth details per principle, but I'll just provide a brief overview for now. So the first one is address power imbalance. So work to remove or overcome historical and ongoing barriers to inclusion and the impact of structural racism. To build trust, establishing long-term relationships with community organizers and residents, to take an anti-racism stance, so intentionally addressing structural racism, white supremacy, and discrimination and exclusion. And using an asset-based approach rather than a deficit-based approach. And Healthy Eating Research has developed some great tools on how we can think about an asset-based approach in our work. So as Healthy Eating researchers and advocates, we can start this work by reevaluating the way we frame our research questions, the introduction to our papers, communities' roles on the grants we submit, the assumptions we make about the populations we work with, or the language we use to describe the people most impacted by structural inequities. Drawing from a common saying in the Black church, people have been making a way out of no way for a long time, particularly when it comes to food. Our work can seek to understand and support these resilient community residents. Next slide, please. The second authentic resident engagement tool that I will discuss is one created by Rosa Gonzalez of Facilitating Power. The tool is called the Spectrum of Community Engagement to Ownership and includes 5 phases. The HFPP guide that I just described was inspired by this tool and adapts some of its content to food policy. So just to orient you to the table, the far left-hand corner includes stance toward the community, impact on the community, our goals as food policy researchers, message to the community, activities, and resource allocation. So the baseline level on this spectrum, as you can see, is ignore, where residents are being marginalized and denied access to decision-making processes. The message that the community receives is your needs and interests do not matter. Signs of this level include systematic disenfranchisement and voter suppression. Next slide, please. Stage 1 is inform, where the impact is preparation or placation, where folks are more so trying to overcome distrust or animosity. By providing information to the community, this sends the message that we will keep you informed. Sample activities include fact sheets. Next slide, please. Stage 2 is consult, where residents and community can be unfortunately tokenized or given limited voice. The message we send to the community is we care what you think. Activities at this stage can include public comment, focus groups, forums, and surveys. And notice at the bottom, though, that this phase may involve investing more resources in consulting, for example. Next slide, please. Stage 3 is involve. Here, the community is given limited voice. The goal would be to ensure community needs are integrated into food policy processes and planning. This sends the message to the community, you are making us think and act differently about the issue. Activities can include open planning forum with citizen polling. Next slide, please. Stage 4 is collaborate, where the community is being delegated power. The intent is to ensure community capacity to play a leadership role in decision-making, including implementation. The message the community receives is your leadership and expertise are critical to how we address the issue. Activities include co-designing and co-implementation, MOUs with community organizations, and citizen advisory committees. Notice that at least 50% of our resources are going to community partners at this stage. Next slide, please. Finally, stage 5, defer to and community ownership is the ultimate goal in resident and community engagement for this spectrum. The goal here is to foster democratic participation and equity through community-driven decision-making. Another key objective is to bridge divides between community and government. This sends a message that it is time to unlock the collective power and capacity for transformative solutions. Activities include community-driven planning and governance, participatory action research, and participatory budgeting. For those that are interested in this spectrum beyond today in this tool, the Facilitating Power tool on authentic engagement includes a series of questions that your team or partners can walk through to determine where you fall on the spectrum and to even do some goal setting. Next slide, please. So spearheaded by my colleagues at the Public Health Law Center, including Julia Ralston, the Healthy Food Policy Project will soon release a food apartheid, food justice, and food sovereignty tool. It will provide an overview of how these ideas and concepts link to food policy, highlights example policies and common terms used in food policy like food desert, hunger, and resilience, and considerations for these terms as we try to apply them more to legislation, including some limitations of each term that we should be mindful of. Next slide, please. I'm sure many of you are very familiar with Shariki's Getting to Equity framework, which includes 4 prongs: increasing healthy options, reducing deterrence, improving social and economic resources, and building on community capacity. Next slide, please. Authentic resident engagement will be critical to this prong, building on community capacity as we work towards equity, especially by leveraging the power that already exists in the community and strategic partnerships. The tools I just shared a bit ago are just 2 examples of many resources that are available to us as healthy eating researchers as we try to apply these principles to our work. Next slide, please. So for the rest of my time, I'll share a little bit about what I'm learning in my work in the North Hartford Promise Zone as an example of resident engagement at the collaboration stage on the Facilitating Power spectrum, and as we inspire to get to community ownership. So the North Hartford community is federally designated as a promise zone under the Obama administration. It's predominantly Black and Latinx, including immigrants from all over the world, has a rich cultural history and many assets, including historical sites. So lately, over the last year in particular, North Hartford residents are working very hard to dismantle structural racism in their food environment, to advance equity in health and well-being, particularly for their children. For a healthy Hartford hub, which includes a supermarket, but also health promoting services, and really a seat at decision-making tables when it comes to policy and programmatic changes. There's a real sense among residents that they're being shut out, and decisions are being made behind closed doors. Over the last year, a lot of their work has in fact focused on equity and inclusion in land use and neighborhood planning processes. To give some context, a new baseball stadium and proposed locations for the grocery store or Healthy Hartford Hub has triggered residents' concerns about displacement and gentrification. The resident group pushed for the city to consider allocating American Rescue Plan dollars toward food equity projects like what we've seen in Pittsburgh, San Diego, and Phoenix. Notably, the successful investment in Pittsburgh was spearheaded by a food policy council. But unfortunately, the work in Hartford, the efforts of the residents rather, was to no avail, and they were shut out of the conversations due to local politics. So the proposed projects did not include a list of food equity projects. These resident priorities, as you can see, connect to food and food access, but the residents are pushing for equity and justice far beyond food. Next slide, please. Here's a list of CBPR projects that I've led in the North Hartford Promise Zone in close partnership with Invest Health organizational partners, but hugely motivated by the ask of the resident groups, which they call themselves the Community Action Task Force, where they've asked for data to help share their stories and to support their advocacy to be included in local decision-making, including a comprehensive neighborhood food swamp audit, a resident survey that looked at perceived food swamp exposure, food insecurity levels during the pandemic, access to culturally preferred foods, and financial security. We also conducted a photo voice project focusing on their experiences navigating a food swamp, but really leaning into proposed solutions. Last, we did a health equity and all policies audit where we compiled all city level policies and programs and classified them by social determinant to identify areas for opportunity. So again, linking to food, but thinking beyond to housing issues and healthcare access. Next slide, please. So these are the neighborhood profiles that we co-created with the resident group. They were designed in English and Spanish. Next slide, please. So I just want to zoom in a little bit so you can see the characteristics of the profiles. As you can see, it starts with this quote, to have quality of life, we must have quality food. Honestly, we probably had 4 listening sessions and feedback sessions just to determine that small box of the profile, to determine really the framing that folks wanted to use in advocating, drawing from this data. The profiles include a description of assets and rich history. It was very important to the residents that we not lead with problems, but rather highlight the value of the community and then move on to motivate the public health challenge that we're trying to mobilize action around. The profiles include maps of food swamp exposure by block group, images from the community, census data on who lives there and vehicle access, and quotes, which exemplifies yesterday's discussion on how child-focused frameworks really impact people. So you can see one quote, the lack of healthy food in Clay Arsenal is killing my neighbors and our children. Next slide, please. So far, the resident group has actually taken the neighborhood profiles that we co-created and launched a To Have Quality of Life, We Must Have Quality Food campaign on social media, as you can see in the images, but also now that some of the COVID-19 numbers are improving in the area, some in-person community forums. And as you can see by the We Need Your Voice image in the corner there, they are mobilizing the community and calling out systemic racism. Our plan is to translate more research findings like this and co-create more advocacy materials with residents. Next slide, please. As I mentioned earlier, the Health and Food Policy Project featured the North Hartford Community Action Task Force. It includes this quote showing that our team of organizational partners still has work to do to push from stage 4 collaborating to stage 5 community ownership. So the quote reads, as a Black woman working in the community, there's this attitude of go get or learn what they want and then come back and tell us. It doesn't feel good. It doesn't feel like the community's owning it. It feels like we're still an organization-led community advisory board. It would make a huge difference if the project deferred to community ownership. Next slide, please. So in wrapping up my time, I wanted to leave you with 3 key points. First, authentic resident engagement is a key strategy to achieving equitable food policy processes, including efforts to dismantle structural racism in the food system. Next slide, please. Resident engagement in the food policy and research process is a spectrum from marginalization to community ownership. And just so that we don't feel overwhelmed as a tool, guides are available to help you determine where you are and where you want to go. And as I mentioned, here are just two examples of many resources available to us: the Healthy Food Policy Project tool and the Facilitating Power tool. Next slide. And the last point is working towards community ownership in our work in food policy and research. It will involve an iterative process of sharing power. So with that, I'll end my time and turn it back to Tracy. Thank you so much.
Thank you so much, Erin. I know that was a lot to get through, but really appreciate you walking us through that. And I'm really struck with, while it seems like there's much more focus on the importance of equitable policy solutions, it's also clear that there's a lot to do. And I really appreciated the summaries of the case studies, because I think it's really important to see those specific examples of community-based participatory research and some of the other models in action. So really appreciate that. And thank you to all the panelists. You can all come back on camera, because we are going to be phasing into the Q&A section for the next few minutes. I do want to just kind of say that for those of you in the audience who work in the academic setting, and I know that's a lot of you, you just had your policy primer for your students all in 2 hours. So feel free to take good notes and present it back to your students, but do it soon, because as we know, it's probably going to change in the next week or so. And again, thank you to the panelists. My first question, we've gotten quite a few, and they're mixed, so that's good. They're a little bit all over the place, a little something for everybody. And I'm going to focus this one first on Jim and Colin, but I actually think there may be some components for both Erin and Kristen to possibly tie into this as well. But can you talk a little bit more about linking nutrition policy work to climate change and other sustainability issues? So Jim, you mentioned a few examples at the state and local level, so feel free to share a bit more, but also, I was thinking about the federal levers for linking climate change, sustainability, healthy food practices. We saw what happened when sustainable food production practices was attempted to be included in a previous iteration of the dietary guidelines for Americans, and it was shot down. What will it take to kind of try to ensure that the connection is viewed as credible and worthy in federal policy change down the road? So Jim, I'll start with you, and then Colin, feel free to weigh in. And then Erin and Kristen, if you have others to share, other points to share, please do.
I think, thanks, Tracy, for the question. And I'll be brief, because you've raised some really interesting federal level questions. What I would encourage folks to do is really reach across the aisle, so to speak, to others who advocates and policymakers and researchers who are involved in the sustainable food and local food, regional food development work, because those are all really centered in climate change and sustainability. And they would have really great ideas to share with you in your local communities and state level work of concrete on the ground things that would really benefit from evaluation by HER researchers and attendees at this meeting. There are lots of win-wins for both improving nutrition security and nutrition diet quality and improving the health of the planet. And I gave some examples of those, just scratched the surface. But I think really where the work begins is at the local and regional level. So I think reaching out to folks doing that local and regional food systems policy change work and food system development work would be a great place to begin. There's not really time to get into a lot of details, but let me make sure Colin and I think Erin, there's so much sustainability work going on tribally as well. So let me pass it on.
I mean, I think Jim actually put it quite well, and Tracy, it already gives me heartburn remembering sustainability being taken out of the dietary guidelines. So I have essentially the same point to make as Jim, which is, well, we have to make this bipartisan. We in the advocacy community are already there in terms of trying to move the needle on sustainability and climate and, say, the Farm Bill or even child nutrition reauthorization. But you have to have bipartisan support in order to pass it. We have to have even our food industry colleagues support some of these sustainability and climate recommendations so that they can work across the aisle with us to make sure that Congress actually passes it and there isn't opposition from industry and we actually can get it into a final package for the Farm Bill or CNR. I mean, there can be work done at the state and local level and bits and pieces of it, which I know a lot of groups are interested in for, say, like looking at procurement for school foods and how is that food sustainable and more climate friendly and how does it impact the environment and building that into standards and practices that schools are doing. But then we have to work our way up to the federal level, which means having a much broader and diverse coalition across the aisle to be able to get this done.
And Aaron, any thoughts on that? I know, like Jim said, there's just an inherent focus on climate and sustainability and food sovereignty efforts.
Yeah, I think I have several examples. My mind, and when it comes to these questions, always goes directly to federal policies that open up more of those local food sourcing opportunities for tribal nations to source food directly for nutrition assistance programs. And to me, that's a sustainability and climate change linkage, because you are moving food a drastically small difference in comparison. Like for FDIPR is a good example. For FDIPR, the way that food is sourced for shelf-stable and frozen food comes from vendors all over the United States to 2 warehouses, one in Idaho and one in Kansas City. And then it is shipped back out on pallets to 276 different tribes around the country. If you are sourcing more local and you're facilitating the kind of investment in Indian country that enables more local sourcing, food isn't being trucked, spending gas and causing carbon emissions all over the country. It's way more local. And I think that that is definitely a linkage that is really important to highlight. And I would also say too, I'd be remiss if I didn't, tribal governments have been leading on that linkage for thousands of years as the original stewards of lands on this continent. So, there's a lot to be acknowledged in that space as well.
Absolutely, a lot to be learned. So I appreciate that perspective on the USDA foods program and how the food gets from point A to point B, many, many miles in between. So, Kristen, actually, or Aaron, one other kind of follow-on question, not quite related to that, but one for you. Can you elaborate a little bit on how school meal programs actually in particular can be improved to allow flexibilities for traditional native foods to be incorporated into the school menus? I know there is farm to school programs and a number of Indian tribal organizations benefit from that, but I don't know if there are other examples, school food related.
I'll let Kristen go first since I just answered. So not to put you on the spot, but I want to make sure you have space.
Actually, that was for you. And then I have a couple more questions for
okay.
Kristen, so don't you worry about that.
Okay, perfect. Sorry to put you on the spot, Kristen. I do have a couple of thoughts about that. First up, I would say, of course, making changes that would enable tribes to run any kind of school-based programs directly through CNR is a big one. But beyond that, it's about getting to those food sourcing requirements that serve as, I think, kind of invisible barriers to equity when it comes to tribal food sourcing. So if you think about, I think the last ERS data that I'm familiar with off the top of my head, it's like 32% of school districts who are sourcing local foods are getting them from the DoD Fresh program. It's really challenging if not impossible, for tribal nations and tribal producers to become vendors for that program or contract holders for that program. The requirements are just, it's pretty strict. You're buying often for bigger regional audiences than smaller mid-sized farms are ready to source from. And so that's a barrier. But there are opportunities that I think USDA has been good about relaxing some requirements for vendor certification on the USDA food side of things that could be models for a better pathway for those foods. So those are things like the Farmers to Families Food Box program, which did not require vendor certification for individual farmers or ranchers or food businesses, which was a huge help in the first couple of rounds for Native producers thinking about seeking that. The Local Food Cooperative Assistance Program that's out right now from AMS is a very similar circumstance. So those places where things like the federal acquisitions regulations can be changed to facilitate more. I know we're all excited Friday afternoon to be talking about the FAR. I'm sorry to be the person who brought that up, but those kind of things, those are barriers. Those are actual real barriers that if they were relaxed, there could be more intentional sourcing, I think, through some pretty common means for schools.
I think that's a really good point. And yeah, the FAR on a Friday afternoon is a little tough, but but totally appropriate. And I think as a person, when I worked at USDA, the first time I worked in the regulatory space, and I saw the power of regulations. We talk a lot about policy in terms of legislative, and oftentimes we need that driver to be able to change the regulation. But there's also a lot of opportunity in the regulatory space. So I think as a person who really enjoys reading a preamble to a federal regulation, there's a lot of power in those as well. Kristen, I'm sorry, sure.
Just to briefly add to Erin's excellent points, just thinking about farmers of color, often referred to as BIPOC farmers, thinking more about linking that group to farm to school initiatives, both from the standpoint of enhancing, inclusion and representation, because as you can imagine, for a young child, being able to see themselves in agriculture and to see themselves as farmers is so critical to creating the future generation of farmers, but also to advance equity in for BIPOC farmers with an economic opportunity, right, to link their foods to a program that is very robust. And so we're doing some of that work. The state of Connecticut has a task force on BIPOC farmers, and we've been chatting about that a lot. It's a really promising area of work.
And I might add, Sarah Blake mentioned the GusNIP program. There's not a single GusNIP grantee that's a tribal entity at this point. And GusNIP is an opportunity to get federal funds in to provide incentives and vouchers so folks can buy fruits and vegetables that are preferentially locally sourced. So that would be a mechanism to try to push on to engage more tribal producers who can sell stuff through the GusNIP program to tribal members, or even to non-tribal members for that matter. I think being creative and looking at the way existing federal and other policies can be leveraged to make some of this work happen would be great, and it would help get to your point of engaging more BIPOC farmers in the federal system, but also state and local.
That's a really good point. And we did get a question actually, Kristen, about how to include racial equity in farm and preschool programming and gardening interventions in classrooms or nutrition education. So you kind of answer that in terms of really reaching out to the local farmers and identifying role models for others to emulate. Another question that came up, Kristen, the authentic resident engagement model seems a little more natural when creating state and local policies. Have you seen examples of it, or can you envision examples of the model also being able to influence and be woven into federal policy efforts or being used to help inform federal policy efforts?
Yes, I think that work would involve a multi-level approach, which could be complicated, but actually really exciting to sort of just have this network of connection and feedback loops, if you will. So the Equity Commission from the USDA is a really like a structural example on expanding that. I believe that commission sort of had some seats for folks with like lived experience or like local representation. They were really intentional about the perspectives that should be represented. So it wasn't one-sided or imbalanced, but you could imagine a federal organization like that or more of those, being sort of the overarching organization from, state feedback, and then the states are compiling like local feedback. So I think that, that it could be a multi-pronged system. But I think as we look at federal policies and programs that, we're thinking about the end user and the client level, it's still certainly important to understand the perceptions among residents of those programs, including, disparities in perceptions of WIC and SNAP going online. It's a really exciting change.
Oops, I think Kristen might have frozen up a little bit, but I think that's a really important point. I think it'll be important for all the participants who are involved in this session today to really keep an eye on that Equity Commission and really there usually are opportunities to weigh in with some of those opportunities as well. So I think Kristen raised a really good point about that. Trying to see if we have time for one last quick question. We do. One question I had, it's kind of one of the questions we got was that the National Institute of Health has really made massive investments in precision nutrition. And the question is, have there really been any efforts to shift this perspective to a more public health approach? How can public health nutritionists be successfully leverage NIH's interest, because there's a lot of funding and opportunities there, but the precision nutrition seems to be fairly narrowly focused. And I'm not quite sure, Colin or Jim, if you have a view on that, and certainly if Aaron, and I'm not sure if we'll grab Kristen back or not, might have views, but Colin, we can start with you first in terms of the NIH angle and whether or not how you see that broadening to a public health perspective.
There might be some attendees who will know more about this. I would look at the NIH blueprint on nutrition that the new Office of Nutrition and Research at the Director's Office developed and is working on, because there might be somewhere there in terms of what's the public health approach versus precision nutrition. But it's something I think we should look into more.
Yeah, I would say I'd be much more excited about getting a National Institute of Nutrition set up, which would then embed in its core purpose and mission having a public health purpose. I think that precision nutrition is much more going down the biomedical pathway. And I think we've seen that we've, as discussed in many of the presentations today, the fundamental issue is what type of food is the food system producing, what's available, accessible, and affordable to people, and how does that shape and influence their opportunities to have healthy foods in their communities. So I think that would probably be more addressed through a National Institute of Nutrition approach than a precision medicine approach.
I think that's a really good point, but I do think, since it does seem to be a trend or whatever you want to call it, it'll be important to kind of ensure that there are opportunities to highlight the importance of making sure there's a public health lens to any of the work that's being done like that. I think we are out of time. Again, I want to thank the participants. I want to thank the panelists. Thank you so much for spending your 2 hours on a Friday afternoon with us and really helping close out the healthy eating research that I was reminded when Dr. Bleish talked about this being her last sort of professional meeting that we attended, and that was the case with me as well. I have not traveled professionally other than going to USDA office in DC since that meeting. So really look forward to next year, maybe being face-to-face. And Megan, I'll turn it back over to you.
Great. Thank you so much, Tracy and Colin, Jim, Aaron, and Kristen. We really appreciate you all taking time to share those wonderful, informative updates for the HER community, really valuable information. And thank you to all of our attendees who have spent so much time with us virtually this week, this being the fourth and final of our large plenaries. One last plug for our virtual research posters that are available on our website. Please check them out. We would love your feedback on these, something new we're trying this year, some really great work highlighted from our researchers. And this session has been recorded. It will be available next week, as will the yesterday and Wednesday's plenary on equity as well. So be on the lookout next week for more information regarding those recordings, as well as a meeting evaluation form. And yes, we plan to be together in person in 2023. So we will see you then. Thanks, everyone, and have a great afternoon.